The opioid epidemic continues to claim lives in East Tennessee. The Knox County District's Attorney General's office says that as of Friday, 6 people have died from a suspected drug overdose for 2019. That brings the total for the year to 26. Last year, Knox County saw 290 suspected drug overdose deaths. One UT Medical Center surgeon says that stopping more people from getting addicted starts with doctors. He says that they should give out fewer opioids after surgery. Reporter Cole Sullivan joins us now with the alternative that he says can manage pain. Cole?
Daniel, Dr. Gregory Mancini says he does about 600 surgeries a year, but he says he's trying to cut down on the amount of opioids he prescribes for pain that patients feel afterwards.
For many, it's the first stop on the road to addiction, an opioid prescription after surgery.
I think we have underestimated the risk that opioids play when we prescribe them as physicians.
The pills may work, but they bring with them a long list of complications and the risk of addiction.
The opioids kind of made us a little bit maybe lazy.
Now, UT Medical Center surgeon Dr. Gregory Mancini says it's time for doctors to think twice before prescribing.
We know now that it's a shorter period of time that it takes for somebody to be addicted, but we also have no idea when a patient comes in what their individual risk might be.
He wants his fellow surgeons to explore options that don't include opiates to manage pain. He says a combination of local injections and over-the-counter pain relievers can do the trick.
We can create an actual better pain plan for management than we would with a simple opioid.
But he says changing the culture of prescribing pills for post-op pain is going to take time.
With surgery, there is pain, and a lot of people have anxiety about that. And so it's important that we address that up front, because oftentimes acknowledging the anxiety about that can lower somebody's concerns.
And he says it all starts with the doctors.
If we can change how a patient feels about surgery and about pain, and if we can change what physicians know about putting the patients at risk, they can go to that conversation and talk honestly, and they can decide what they can do with regards to narcotics.
Dr. Mancini says patients should be advocates for themselves. If you're talking to a doctor about surgery and you're worried about taking opioids, he says you should ask about what alternatives are available. Daniel?
An important story there, Cole, thanks. And if you or someone you know is struggling with addiction, you can contact the Tennessee Red Line. That number is on your screen. You can also find help with the Metro Drug Coalition and the Partnership for Drug-Free Kids.